by you and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We're a certified home health care agency servicing Palm Beach County, Broward, Miami-Dade, and we can be reached at 954-717-7027. I am your host, Louise Gomez. Thank you so much for tuning in. Today we have with us Dr. Ahmed Riaz, and he has the Riaz Clinic right here in Fort Lauderdale. The address is 3342 Northeast 34th Street, Fort Lauderdale, Florida, 33308. And the phone number is 954-358-2363. And he can be reached at the RiazClinic.com. Instagram is at the Riaz Clinic, and the Riaz Clinic at gmail.com. Thank you so much for joining us, Dr. Riaz. How are you today?
I'm doing really well. Thank you. How are you?
I'm doing wonderful. I want to thank you for taking time out of your busy schedule, because I know, doctors have a lot of, crazy hours and schedules, so I want to let you know in advance that we appreciate you taking your time to do this. And so, Dr. Riaz, can you share with our listeners a little bit more about your background and a little bit more about your experience, education, and training? Where did you go to school and whatnot?
Sure. So I am what you call a sports medicine doc and family medicine doc. So a little bit about my background. I used to be a high school athlete. Used to play football at 140 pounds. So you can imagine I got injured a lot. Was in the training room. Yeah.
Oh, yes.
So I found my love for orthopedic complaints, shoulder injuries, knee injuries, ankle injuries. So that, I think, was my true initial calling to start loving sports medicine. So I went to FIU for undergraduate, then I went to medical school up in Georgia, and then
Nice.
found my way back here to Miami at West Kendall Baptist Hospital, where I did my residency in family medicine for 3 years. And then this past year, I just graduated in sports medicine at Nova Southeastern University.
Wow, congratulations. I love hearing stories like this because you're passionate. You did your football, you did that, and so firsthand, it sounds like you played football, so you experienced firsthand injuries. And so did you break anything, or was it, can you share? I'm just curious, what happened to you?
So we were doing some tackling drills right before a game, and I almost dislocated my shoulder while tackling somebody. So I wasn't able to move my arm. I was super scared. I'm like, how am I going to ever write again? How am I going to use it again? But I was super, super grateful for the orthopedic staff, the physical therapy staff that helped me get back to doing simple things such as putting on a shirt or combing my hair. So I really, really can empathize with anyone going through injury, and I can be in their shoes. I know the long struggle process it takes to get back to where you need to get to.
That's a huge component, because you're actually serving people that you've had experience in that. So the level of empathy and compassion, it's remarkable, because I'll tell you personally, probably 8 weeks ago, I fell down my stairs and I sprained my ankle. And so until that happens to you, you don't really realize, like you said, just a simple thing like putting on your shirt, or for me, I couldn't put a shoe on for a couple of weeks. But so the simple things like that, and you actually experience that. So I would imagine your patients are happy to have you as a doctor, because I know that's what I look for, is that type of compassion. Yeah.
Right, of course, and I love to treat everyone as like my family. Sometimes I feel like, especially with the elderly population, is whenever they see a doctor, they get written a prescription, they're out the door, but no one
Right.
really explains to them what's going on, what's an injury, what's a sprain. Explain to me the anatomy. So I try to take my time and try to go through step by step process, answer all their questions. I do take a lot longer than your typical doctor, but I want to make sure that all your questions are answered before you go out the door, and I think patients appreciate that.
Oh, absolutely. That's, as you know, that's our number one complaint, as a patient. We always feel like, "Oh my god, I'm rushed and the doctor doesn't listen to me and they have no time." So just for you taking that extra step and, engaging in that deep conversation, I feel like that kind of puts the barrier down, and then people are more open to,
Exactly.
want to converse and want to reveal more information. And Dr. Riaz, can you share with us what is the age range of patients that you treat? If you can
Sure.
share. Thank you.
Uh, so, as a family medicine doc, we treat from the cradle to the grave. We like to say, a
Wow.
newborn baby
Okay.
to the elderly. I've kind of tailored my practice with sports a little bit more to like the teenager to the adult. So, my oldest patient is 97 years old, and try to treat them, and they're as active as a 16-year-old. So, I get a wide range of patients to treat.
Nice. So you get the whole gamut of patients. That's really good. And what type of insurances do you accept at the practice? Do you take major insurances? What might they be?
Yes, so I opened up about 8 months in practice, so still fairly new, still in the process of applying for other insurances. So I do take Medicare, I do take Medicaid. Recently got approved for Cigna, and I also take
Nice.
Ambetter insurance. So I'm hoping in the near future start seeing a lot more patients. But I do also want to tell your listeners, growing up from humble beginnings, if you don't have insurance, I do not want that to deter you from coming to see us. Please give us a call. We'll see what we can do to try to help you out. I remember growing up, our family, we didn't have the most of money, and finding a good doctor, good insurance was always a struggle. So I really want to be able to help someone that if you're not able to find the doctor, just don't feel scared to seek out attention because of cost. So we'll see what we can do to try to help you out.
We appreciate that, because that could be a determining factor for certain people who maybe are, they say, "Oh, well, I don't have insurance and I don't know." So, we're happy to know that, you're willing to see all patients. That really is definitely something that people want to know. So, thanks for that. So, what are your true areas of interest? What is it that you're like, wow, I'm getting a patient that's coming in with, what is it, XYZ? Is there even a special area of interest, the particular type of
Sure.
interest? Uh huh.
Yeah, so one of my favorite things to see, probably not as much for the patients, but it's to deal with arthritis, especially knee arthritis. We see it much more and more common in our working population. I've seen it as young as even 40s or 45s. We live such an active lifestyle. Some are construction workers, some are house workers that they're cleaning all the time. They put a lot of wear and tear in their knees. And a lot of times people think that surgery is the only option, but that's actually not the case. We do have a lot more non surgical options that we like to advocate for our patients. For example, just simple stretching and physical therapy is really, really big component of helping with a lot of knee arthritis. A lot of times, stretch properly, exercise and are flexible, and that can contribute to a lot of the pain that a lot of our patients get. So I'll say about 40 or 50% can actually just get better with simple physical therapy. Other things I like to offer in our clinic, we do injections as well. Let's say therapy doesn't work for you, oral medications don't work for you. We can do cortisone injections or gel injections. Uh, Interesting things that to know about cortisone. I'm sure many of your listeners have heard about it. It can be kind of like a fire extinguisher. You're aching in pain. You want to go on a trip. You want to go on vacation. You need some pain relief. We can do a quick cortisone injection to kind of calm it down. It's not going to cure your arthritis, but kind of get
Sure.
you through your trip and get you going. So I like to say it's a spectrum from 0 to 3 months, meaning that you can get, if lucky, you get 3 months relief, and if you're unlucky, you may get a day relief. So there's no clear guided science that you're gonna for sure get better, but it can help. A second option is we also do some gel injections like hyaluronic acid, or the rooster shot, as some people may know.
Oh, I didn't know
So
that's what they calls it, the rooster shot. Okay, good to know. And
I
that's
believe they're derived. I'm
only
sorry.
for the knee? Is that only for the knees?
Yes, for
Oh,
now, from what we've seen in the studies, is for the knees. So I like to say it's the WD-40 of the knees. Can lubricate it, keep it going a little bit more. The lifespan of treatment is a little bit longer, from 3 to 6 months. So a lot more patients like that because there are not as many injections. And the newer treatments, which we're not offering yet, but from my studies and my training, is called PRP. It's called platelet-rich plasma therapy or stem cell therapy,
mhm.
which has been a lot more, getting a lot more attention. So a little bit background of that. What that is they take out blood just like you do for a regular blood draw. They spin
Okay.
it and they
Yep.
separate the layers of healing properties. So you have a lot of white blood cells in that component, and they can inject that back into your knee. It's pretty much your own body, so no real big side effects, and it can last up to a year of relief. So these are all newer treatments that we have.
Yes, I've heard of PRP. So a quick question. If somebody uses PRP, you said they can do injections in the knee. Would that help them with arthritis as well as if they have, I don't know, torn ligaments
Yeah,
or
for sure.
interesting.
So it can help. So it has a lot of healing properties and factors. So, for example, if you cut your arm, you start bleeding, you
Yeah.
have that scab that forms right away because your blood has a lot of healing properties. So we use the same healing properties of platelets and inflammatory properties to help your knee. There's a key caveat though. A lot of people think you're going to get brand new tissue, brand new cartilage. That doesn't happen, but it can definitely calm down the inflammation and the pain. And there's very minimal side effects because it's your own blood that you're putting back into your system.
Interesting. And so, on average, is that something somebody has to do in cycles or in, like, I don't know, sessions? Maybe they need five, or just depending on how bad it is, or they do sequential treatments?
Yeah, so generally it's indicated for patients with mild to moderate arthritis. If you have severe arthritis, bone on bone, you're probably not going to get much relief from it, to be honest. But if you have mild to moderate, you usually can do well with 1 or 2 injections, and that should last you about a year. And if it works, you should give it another try. If not, then it may not be for you. So it's really 50-50 trial.
Sure.
We do know for like lateral condylitis, like the tennis elbow, it works
Yeah.
really great. But for other things, it doesn't work as great. So it just depends on the severity of it. Um, the one key, I guess, negative of it is that a lot of insurances don't cover it, so it can be a little bit costly because it's out of
Mm,
pocket cost.
sure.
But if you can afford it, that's a viable option. We do know with the side effects of steroids, when you get too many steroids, it can cause a lot of toxicity to the joints. So you can cause faster degeneration. It can speed up your arthritis. So we don't recommend getting more than 2 or 3 a year. So you should try to space those out as much as possible.
Wow. So we're going to take a commercial break, Dr. Riaz, and when we come back, we're going to talk a little bit more about other treatments, and we'll discuss a little bit more about other things that you're doing at the clinic. Thank you so much.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to another episode of You and Your Doctor. We have Dr. Ahmed Riaz at the Riaz Clinic right here in Fort Lauderdale. It is 3342 Northeast 34th Street, Fort Lauderdale, Florida, 33308. He can be reached at 954-358-2363, the riazclinic.com, and Instagram handle is at the Riaz Clinic. Thanks for coming back, Dr. Riaz. So, can you share a little bit more about your story and, the name of your clinic and how all that got started? I think maybe you have a little something you dedicated to somebody, if you can share that.
Sure. So the Riaz Clinic, my last name is Riaz. I'm very family oriented. Born and raised in Miami. We have 100 cousins, aunts, uncles. We all live close to each other. So we
Wow,
all,
that's a
yes.
huge family. That is, oh, I love that. Thank you for
Yeah.
sharing that photo with
Yeah.
us.
So definitely family is something very important to me. So my grandfather back home in Pakistan was a physician. He used to
Yes.
take care of a lot of the community members. He used to provide a lot of charity care, try to help others. They used to come from all walks of life. They try to come to him for care. And I wanted to build a clinic under his name of his legacy. His last name was Riaz. I'm sorry, his first name was Riaz, and I think it's a good dedication for him because I want to be the same source of care from my community. Born here from South Florida, I want to help everyone in our community and try to get them the good care that they deserve and require.
I love that story. He certainly made an amazing impression on you, and now you have this legacy with the name of your clinic, and not only that, with the work that you do, with patients, you're continuing his legacy. That's a beautiful story. So, wow, you have a
Thank you.
big family. You have a nice big family. Do they work with you in a lot of the family members help out in the clinic, or?
No, not yet. So my dad is actually he owns an ice cream store at Carville. My mom's a housewife, so my
Okay.
cousins in our generation we start becoming doctors. So they all have different specialties. So maybe in the future we may open up a medical center. We'll see.
Oh, good. I like those goals. Those are really good goals to have, having a medical center. Why not? So, yeah, I wanted to get back to, I think it's so interesting, all of these treatments that you have, because as we age, like you said, the knee, or I don't know, something, the tennis elbow, all these different things that, happen to us. Um, you know, I like that you have different options. You're not just prescribing like here's a pill and it'll take care of your pain. No, you seem like you're very specific as far as treating the patients with different options, and I like that. I
Yeah.
really do, and people
And
like
I
that.
believe, like, yes, not everyone's created the same, right? Everyone has different problems. They need different types of approaches and treatment. I also like to offer two different things. I also have an ultrasound at my clinic, so we can do further diagnostics. So let's say, for example, you have knee pain. We can have an ultrasound and do it at bedside. It's quicker than an MRI, right? We have it right there. We have the results. Do you have some fluid in your knee? Do you have something torn? Can we address something, get you kind of quicker treatment to kind of guide it? Second
Mm,
thing I also like to treat as well, we also offer in our clinic for patients with back pain, for example. A lot of patients come with back pain. They're told to either take narcotics, get injections
right.
on their back, but not everyone is very fond of that. So, as a DO, what a DO is, we have extra training. We use our hands to help treat our patients. So, we can do kind of like a massage, but we kind of correct abnormalities in the spine. We do different stretches to help provide mobility and some pain relief. And some patients like that because it's not just a prescription, right? That's going to be temporary,
Right.
but it can provide some relief on site.
Yeah, it's literally hands-on, which is, people want that. And I also like the fact that you're doing the ultrasound right there, so they're able to, they're able to know right then and there, and then you're able to decipher what is one of the best treatment options for them. So
Right, and you could also see the anatomy as well, right? If a tendon's messed up, you can be like, hey, this is a tendon that's irritating you. We see inflammation, we see it's thickened, and here let's try to make a treatment plan just for you to target that. And I think a lot of patients can visually see what's wrong with them, and that helps as well.
Oh, definitely, definitely. So we have a couple of minutes left before the show is over, but Dr. Riaz, I wanted to, maybe if you can share with us some good experiences, some of your, maybe one of your patients or anybody that stands out to you that had a good experience, and then maybe some tips and tricks you can leave us with as a an active person.
Yes. So I guess I can start maybe with the tips and tricks. I would highly, highly recommend everyone, please get out and exercise, even if it's 15 minutes a day, even if it's 10 minutes a day. Go for a nice walk.
Yeah.
Go do yoga. Go do whatever you want to kind of get some mental relief. I feel like with COVID, everyone's been stuck inside. Anxiety's been high. Stress has been high. So
Yes.
please just get some fresh air. The Academy of Family Physicians actually they recommend of getting at least 30 minutes of exercise 5 days a week with
Mm-hmm.
about moderate to mild intensity, meaning you break a little sweat, not so much that you're bent over and not can exercise the next day, but at least try to get outside, and it's going to help with a lot of ailments that we have. I see a lot of patients with diabetes, blood pressure, cholesterol.
Yes.
You're on so many medications, and if you can work on dropping a little bit weight, exercising a little bit more, you can hopefully come off a lot of medication. So, as a primary care doctor, I would highly, highly recommend to do that. And I know sometimes we're busy. We say we don't have time in the day, but if we don't have 15 minutes in the day, do we really have a life? So we have to try to make effort, right, to
Good
take care of our
point.
health. Yes, that's super, super important.
Mm-hmm.
Patient experience. I would say I really like enjoying spending time with the older patients, my 97-year-old patients. They're very sweet, very old, but they're very active. So I try to help them from not being too active, where they want to do everything. So just doing simple encouragements of, your mind may be a little bit faster than your body, so take it easy. Don't climb up the ladder to change the light bulb. Do simple things to hopefully help prevent injuries and falls is very, very important. And that's why I'm a big, big proponent of doing physical therapy as well, to help get you mobility, stretching, prevent further falls and injuries. Because we know if you break a hip, it's just downhill from there. You're going to have other complications. So we're trying to really encourage our elderly to be a little bit more proactive and not too active in a sense.
I like that. Be proactive, but not too active. Okay, that's good. And thank you so much, Dr. Riaz, for sharing with us all of your all the information about your clinic. And everybody gets to see you who has any type of physical therapy challenge or sports challenge. And again, I'm going to repeat the phone number is 954-358-2363. The website is theriazclinic.com. Thank you so much for joining us, and we look forward to your success with your clinic. Thank you so much.
Thank you, Lois. Thank you so much for having me. It was a pleasure.
Absolutely. Take care.